Hi, good evening everyone. I'm Dr. Lalit Verma. I'm a pediatric gastroenterologist and hepatologist at Wockhardt Hospital, Mira Road. Today we have this 1 hour Facebook chat discussion where we're going to talk about a few aspects of pediatric gastroenterology. Thank you for the overwhelming response which our team has been getting on the Wockhardt website. I do have few questions ready with me, and I'm just going to, in the meanwhile, I'm just going to address some of them. So the first question which came earlier was, if my kid has been complaining of stomach ache, when should I take him to a doctor? So basically it depends. There are two types of pain, or you can grade them into two things, like acute and chronic. Chronic is something which has been there for more than 2 months. Acute which happens within less than 2 weeks. So depending on the severity, the location of the pain, it's makes it important that you take your kid to a pediatrician or the specialist whenever there is problem. The second question which has come is, my child gets stomach pain quite frequently. Does she have an allergy? So there are multiple causes of abdominal pain, which can be because of constipation, which can be because of acidity, which can be a functional abdominal pain where there is no actual cause. Allergy, of course, is one of the etiology of a pain, but there will be more signs, although it can present in this subtle way as this one. But yes, you can consider allergy as one of them, but I wouldn't rate it very highly on the top of the list. The other one that has been coming, and I frequently get this question in my clinic patients, mostly from the North Indian community. So this is, my kid has celiac disease. Does he need a gluten-free diet all his life? So basically going over celiac disease is something, as our other audience are also watching this, I want to make them aware that it is a gluten sensitivity. Gluten is found in wheat, and this is more like an autoimmune disease which falls in the same spectrum of diabetes mellitus or autoimmune thyroiditis. Apart from wheat, rye barley, which is also called as jaw, has this protein called gluten. And what happens is, when the susceptible host consumes this gluten, it gets into the system and an antibody is formed. Now when this antibody is formed, it attacks your mucosal lining of the intestine, and the effects are seen. So it can take around 3 to 4 weeks or even longer. It can present in very subtle way. Just last week I saw a kid who was not gaining his height, so he was stunted for his growth, but his weight was fine. So then I sent some markers, which includes a tissue transglutaminase, which is a simple blood test, and the levels were quite high and kind of confirmed celiac disease. Although you need an endoscopy, which is a tube which has camera in the front, looking down into the stomach and into your small intestine, and we take few samples to confirm this, and this is the gold standard. Again, the treatment part does depend on a gluten-free diet. You have to be very cautious about this, because even a simple amount of gluten can flare up the symptoms. Abroad, the gluten-free diets are easily available. In India, although we have been seeing more patients, and soon there will be more gluten-free products available in the market. The next question that I've been asked is, my kid doesn't eat home-cooked food. What should I do? Now, I think all parents come across this whenever their kids are toddlers or even older. Kids are, they're very smart. They know how to get their way around. What one can do is, it's the presentation of food and the aroma which also matters. You have to present certain food in a certain way and make them look fancy or eatable. That's all I can suggest. And even in even a pasta which is wheat based, I don't mind that. Cheese is also a good source of protein, so cheese is also fine. You can try various combinations and make your child eat. Of course, no screen time, no TV while they're eating. The next question is, my kid has a poor appetite. What can I do? So again, this is concerning, because poor appetite does not necessarily mean that kid is not interested in the food, although it can happen, but we have to look at the underlying cause of it. There are various blood markers which we need to send. A diet history is really very, very important. There are a few conditions where a kid loses interest in eating, and if this poor appetite is associated with weight loss, then of course we have to intervene at the right time. The next is, my kid has lactose intolerance, how can I help? Now, lactose intolerance, frankly speaking, there are less than 1% who actually have lactose intolerance. Usually when we speak about lactose intolerance, it's an enzyme which is present in the small intestine. It is called lactase. Lactase helps break down the carbohydrate, which is lactose, in the milk and other dairy products. As I said, less than 1% in the world population have this enzyme deficiency. The other cause is when you have viral gastroenteritis or a bad diarrheal illness, transiently or for a very short time your lactase content in the blood can go down, and then this can lead into partial lactose intolerance. But it really requires a good amount of study, which is your lactose tolerance test, to be able to diagnose lactose intolerance. So I will advise, unless somebody has really gone into details checking all these markers and lactose intolerance test, hydrogen breath test, I would not take away their milk, which is really an important source of nutrient for young kids and toddlers. Do we have more questions coming? Okay. So the next one that I've been handed over is, what is Crohn's disease? Interesting. When I was abroad, I've seen at least 200 plus Crohn's disease patient, because there are a lot of patients, including kids, who have this very severe chronic disease. Now, Crohn's disease is an inflammatory bowel disease. It affects your lining right from the mouth end to the bottom end, which is the anal end. It mostly affects the last part of your small intestine, which is also called the terminal ileum, and they have lesions in the large gut also, which is the large intestine. Now, what happens? It presents in a very subtle way. Some can have stunted growth. They can lose their appetite, plus minus weight loss. Some have diarrhea, which is more than 2 or 4 stools per day. Rarely with blood, because it is more commonly seen in ulcerative colitis. They also have other findings apart from the intestinal system. They can have arthritis or joint pain. They can have elevated liver enzymes. Now, to confirm this, the only way out is to get the biopsy samples by doing the colonoscopy, which is obtained from the terminal ileum, and multiple biopsies even from the large intestine. Plus, we also do at the same time the upper endoscopy or gastroscopy to confirm the diagnosis. This then goes for the histopathology test, and then we are able to tell whether this kid definitely has Crohn's disease or is it something else. Because in India, you also deal with TB, abdomen, which is the most commonly differential diagnosis that you come across in this inflammatory bowel disease. The next question that is coming through is, my kid has celiac disease. Does he needs to be on gluten-free diet all his life? This I've already answered. The next one is, how much water should my 8-year-old son drink? Interesting. So really, drinking at least 2 liters of water for anybody is just fine. You don't have to overdo things, because you can get liquids from other component too, but yes, fresh water and clean water is of utmost importance. The next one is, my kid has nutrition deficiency. What should I be giving them? So yes, I had written this article called Fussy Eater, and the next one that is coming that I'm working on is nutrition and overweight kids. So there are 2 types of different signs or symptoms. One is like being fussy eater, the other is like being overweight. Fussy eater, at least 50 to 70% of the parents do come across kids who have fussy eating habits between ages 2 and 6. It then slowly starts subsiding. Fussy eater is like, where these kids are very picky eater. If fussy eating is associated with a loss of weight, then it's a very concerning sign. So you have to make sure that your pediatrician or the primary care provider definitely has 6 monthly or annual charting of the height and weight according to the age group. Fussy eating, you have to keep attempting to provide them the nutrition as much as you can. It so happens that kids will keep refusing, and your job is to keep offering them the necessary nutrients. At least wishful thinking is that one day they'll be eating that same food that you have been giving them. Make sure that you give all 5 food groups which are important, and I hope if there's any concern, then you can always see a pediatric gastroenterologist who can help you around. The next question that is coming through: are cough syrups good for children? But I'm a pediatric gastroenterologist. I can answer this. Being a pediatrician, cough syrups abroad are strictly not given under age 4. So again, you can check with your doctor if it's required, and they can help you in a better way. The next one is: my daughter loves chocolate. Is eating a little chocolate every day okay? Chocolates, a little chocolate once in a week is fine, but eating chocolates every day, according to me, should not be done. It has a lot of calories, it has a lot of sugar component in it. There are risk of getting dental caries along with it. It's not a very healthy source anyway, so I would avoid it eating every day. My kid has weak tummy. How do I improve his immunity? Now, I don't understand exactly what weak tummy means, but if you mean like he gets this frequent diarrhea and you feel that his immunity is down, then of course somebody should be looking into his, somebody should be doing a physical exam, which includes a thorough history and physical, finding out what is the course of multiple episodes of diarrhea or this frequent passage of stool. As I said, Crohn's disease can present in the same way ulcerative can present, but there will be little blood in it. We should be doing a thorough evaluation along with some laboratory marker, which is includes a CBC, ESR, and a liver function test. And if required, a stool test, because many times in developing nation like ours, we do have infections very commonly. Is there a constant? If there is a constant pain in the right upper abdomen, is there something to worry about? Yes, right upper quadrant, or the right side of your abdomen, upper part, is where your liver and gallbladder is. So you have to make sure that the kid is not jaundiced or it's not yellow looking. The other thing is, in the older age group, mostly in females who are a little on the heavier side, gallstones can happen, especially given the scenario that there is also a bleeding disorder in the family. We should at least do a physical and history, apart from doing a sonography, which might help to exclude few conditions. The next one which has come is interesting. It says that my 2-month-old daughter has been diagnosed with biliary atresia. Does she need a liver transplant? Okay, so going over, biliary atresia is a very serious condition. Babies are born with biliary atresia. It is the lack of the bile duct, which is a tube which carries the bile from the liver into the intestine and carries the toxic material out of your system. In biliary atresia, these ducts are not present since birth. Now, eventually, or over the period of time, when the dirty part or the toxic part is not thrown out of the body through the intestines and the urine, then the liver becomes scarred. Most of the functions that you know of, like production of your proteins, your immunity, everything is guided by liver. There's a very high risk of bleeding once your liver becomes cirrhotic. So initially, the first step is to diagnose the biliary atresia, which is done by multiple ways, including your blood profile, your diagnostic tests like ultrasound, and finally a liver biopsy, which is taking out a sample out of the liver and sending it for pathology. Now, once that is done, once it is confirmed, the next step is there's a procedure which is called Kasai, and it is safe to do that, or the better outcomes that we obtain are within 90 days. So earlier you do it, the better it is. Kasai will help bridge that bile duct to the intestine, so it will connect the liver with the intestine, and the bile will start flowing. Now, this is not the permanent solution, because eventually there will be a lot of infections within the bile duct or the duct that has been created, and a patient will require liver transplant. But liver transplant again is like a big surgery. There are beautiful outcomes nowadays. The survival of 5 years is more than 90%, and India is following pretty much the Western standards these days. It is done, and it is the only final solution for a biliary atresia. The next question that is coming is, how do I know when my tummy troubles signal something more serious? Well, what I understand from this question is, if there's frequent abdominal pain, then again there's a rating, like there's a scale of 0 to 10, which you can give it to the kid who knows the counting. So usually done between or more than 7 years of age. Now they will be able to tell you the severity of pain. Now again, the location is important. If there are any associated findings with this kind of abdominal pain, like loss of appetite, loss of weight, is there any diarrhea or constipation, then it will help us better to understand this condition. But it is important again to visit your pediatrician or a pediatric gastroenterologist if you have one available in your city. The next is, my kid has been suffering with constipation since childhood. What should be done? Now, at least 20 to 30% of our patients that we see in our clinic, being a pediatric gastroenterologist, are chronic constipation. Chronic constipation is something which has been there for more than 2 or 3 months. Again, the important thing is to rule out some serious condition which is called Hirschsprung Disease, which can present exactly at the time of birth or newborn period. Sometime it can be missed, but most of the times a good clinician will be able to pick things up. In the Hirschsprung Disease, what happens is a kid will not pass stools within 48 hours. Even if the kid has passed stool, and if it is a short segment or very small area which is involved in the Hirschsprung disease, then they will have this abdominal distension or bloating, and these kids will be constipated. In Hirschsprung disease, what happens is the nervous system in your distal intestine, or the last part of intestine, is not formed completely, and there is kind of narrowing, and the kids are not able to pass stools on their own. And there will be an overflow incontinence, or they'll have this accidents while passing stool. So this was about Hirschsprung disease. Now when we come to constipation, kids around 2 or 3 years, they have something known as functional constipation. They're also trying to get toilet trained. There is always lack of fibers in these kids, and they can have stool passage only after 2 or 3 days. Sometimes it is very hard. So there are different criteria, and we need to find out whether it's really constipation. Now the other thing is, to treat constipation, there are a lot of new drugs which have come in the market. I personally believe in something called PEG 3350, so any of the products based on PEG 3350, and there are a lot of available in the market. It has beautiful results. Plus you also need to increase the fibers in your diet. You have a lot of fruits, veggies, green veggies, and adequate amount of water, and then at least give them 3 to 6 months, and eventually it does get better. In case there's still a concern, then you can see a pediatric gastroenterologist. The next one that has come in is formula milk advisable if the baby is not on breastfeeding or has digestion issues with packaged milk? Well, depending on the age group. So again, we always, as a pediatrician, we always recommend more than exclusive breastfeeding till 6 months of age. If there is any problem with the breastfeeding, or if it's a working parent and due to some issues, if it's not available, then yes, formula milk can be given. Beyond 1 year of age, you can start cow's milk, which is your regular milk. I strongly suggest do not start cow's milk less than 1 year, below 1 year of age. There are a lot of allergies, and it's called cow's milk protein allergy, which can prop up, so you have to be cautious with that too. The next one that has come up is, my cousin has lactose intolerance, what can be done? I've already discussed this topic. But first thing, you have to make sure that it is not really a lactose intolerance. The second thing is it has to be diagnosed properly, and once it has been diagnosed, you should take away all the lactose in your food, and that's the only way you can help yourself or your kid. What are the physical activities you will suggest for kids after 10 p.m. so that kids do not get acidity or digestion problem? Well, I would advise them to sleep by then, but if they're still awake, ideally the recommendation or the things that you should follow is you have to give them meals or dinner or supper by 7:30 or 8 p.m. There should be a difference of at least 2 hours before they hit the bedtime. There's no particular activity, especially no running and jumping around, but yes, they can sit and finish their homework. They can go for a walk, which is possible along with the family. The next one is how much fiber should my son eat in his diet? Now, fibers again, it's usually around 2 grams to 10 grams of fiber based on the age, but there are no strict criteria on the amount or the size of the fibers which should be given. So you can, ideal way is to give them fibers in the diet, and you get a lot of fiber-rich food that you might be aware of, and based on what your food habits are, the food groups you can select, and you can do the same. Thank you. The next one which has come in is my son has gastric acidity and he's been on Pan-D. What should be done? Now again, gastric acidity and ulcers and abdominal pain, they go hand in hand. So what happens is, unlike what everybody thinks, kids have the same problems with the gastric system as the adults do. In fact, if I can say, they have more issues than even the adults. So apart from gastric acidity, there is also gastric ulcers, which are more common. Now what happens is, acidity is related to the stress, it's related to your food habits, but there's also something called H. pylori, which is an infection. Now to rule out this H. pylori infection and to note the extent of the damage that this acid might have done, an endoscopy, which is putting the tube from the upper end, is advisable. Now this helps to obtain some samples to get to know whether there's really an infection. Apart from that, it also helps us to find out if that acid which has come up, or which is called reflux, has affected your esophagus. So it's really important for us to know, before, and I would strongly suggest that before you start Pan-D, which is your acid suppressing medication, this kid definitely needs an endoscopy to find out the extent of damage and the cause. If it's H. pylori, it can be treatable. It can be treated, and it requires at least 2 weeks of antibiotics along with an acid suppressing medication. I hope I answered it. The next one is my child is a picky eater. What should be done? Now yes, I've already discussed this. Fussy eater and picky eaters, they are same. So give them time. Between age 2 and 6 is very usual to have this fussy eating habits, and kids are mostly picky. Allow them, give them time, do offer them various kind of foods, make it presentable while you're doing it. Keep offering them the same food each day, and this will definitely help. Now if there's a weight loss, it's concerned, you follow the growth chart, and if they're following that, then it's fine. The next one is my baby who's 2 months old has been having this frequent vomiting. What should be done? Now, spit ups or gastroesophageal reflux is very common in small babies, especially less than 6 months old. And if you have a baby, you'll know that at least 70 to 80% of babies do have some kind of spit up. Now the concerning or red flag is when they have been throwing up or vomiting out at least 30 to 40% of their intake. So say for example, a kid has taken 100 ml of milk and is throwing out 50 ml, then yes, it's a major concern. You need to find out the cause. The other thing is what happens in gastroesophageal reflux, even if they're not throwing up, even if they're not vomiting, some of the vomiting content, some of the reflux content can go into the breathing tract, which is called trachea, and then they can later on in life have asthma, they can get this pneumonia, they can even get into sudden infant death syndrome, which is like which should be a no-no. For somebody who has G reflux with vomiting, you should make sure that there is no drop in weight. Of course, once it has been diagnosed by doing a clinical exam as well as an endoscopy, an acid suppressing medication can be offered. If it is not, there are few things which are surgical also, so of course it will need an abdominal ultrasound as well. Okay. Do I need to incorporate rice in any way, or it's fine? Yes, rice has a good source of protein, so it is important. But if for some reason, if your kid is not eating rice, it can be given in the form of, say, dosa, which is a mix of dal and rice, I believe, or they can be given idli. But yes, rice is a good source of protein, and I think you should continue that. In case you have more questions, you can log on to face-to-face at wockharthospitals.com, and then you can also see me at Mira Road Clinic if you happen to be in Mumbai from Monday to Saturday between 12 and 8 p.m. My niece is spotted with black dots on the skin near chest, and it is increased on the backside too. What can be done? Now this really requires somebody to see her in the clinic. There are multiple reasons she might have got this, not necessarily food allergy, but yes, there are multiple things we need to look on. The next one that has come in is some blood spots noticed in my kid's stool. Well, again, it is concerning. Again, it's a red flag for me. Now, any blood in the stool warrants immediate action. There are multiple reasons for a blood in the stool. In India, you can have right from infection, you can have a fissure or a small cut around the bottom area. Then there's something called inflammatory bowel disease, of which I've discussed one, Crohn's disease and ulcerative colitis. Very frequently we come across overgrowth of the mucosa, which is polyp, which usually runs in the family, or it can just be an isolated finding in one of the kids. So now blood in stool needs to be checked, first thing verified whether it's really blood. Of course, if it's obvious, then no saying, but we need to send the stool studies. The second is we should send a CBC to check for hemoglobin, and some inflammatory markers needs to be done. And most importantly, if it's really concerning, then an endoscopy needs to be done, which is the colonoscopy, looking for any polyp or inflammatory bowel disease in that case. The next one that has come in is my kid has been diagnosed with the gallbladder stone. What should we do? Again, please, while sending these questions, also send me the age group, so that will really help. Now, gallstones are stones in the pouch beneath the liver, which is called gallbladder. Now, the function of the gallbladder is to store the bile and release the bile whenever required. Now, gallstones can have various reasons. It can be because of a bleeding disorder. It can be because of high cholesterol. It can be because of the infection. So, and you have to also make sure whether this gallstone is infected, which is called cholecystitis in that case. Now, you have to do the ultrasound of the abdomen to rule few things out. Apart from that, we need to see a pediatric gastroenterologist and find out the exact cause. The next one which has come in is my son is 19-month-old, very active, smiles, laughs, plays well, but can't speak a word except mama and dada. Do I need to worry at this age? This is more to do with the pediatrician, but definitely beyond 18 months, once you cross, there's something called early intervention which is required. So please see your pediatrician to sort out if there is a speech delay. More questions here. Okay. My kid has this vague pain in the bottom part of the abdomen. What should be done? Well, any pain anywhere in the abdomen is not good. It needs investigation. As I said, if it is more than 2 months, then yes, it fits into more like chronic abdominal pain. It can be a simple thing like constipation, which can be treated, or it can be as bad as something like inflammatory bowel disease. Again, this needs a thorough workup, good history and physical by the required professionals. My kid has been diagnosed as obese or is overweight. What should we do? So interesting. This month I finished writing up an article on childhood obesity. I think unlike what we think, it's as common as it's in the West. It is really alarming. Obesity is nowadays getting more common in India because again it has become a sedentary lifestyle. The kind of food that you eat is again fast food. Your pizzas, your burgers, a lot of chocolates. Plus there's more of screen time these days, which includes your TV, your video games, and so on. I think kids need to be in a particular percentile, whether it's their height or weight, because again obesity, the outcome is not as great. They can have this cardiovascular disease later on in life. They can have diabetes later on in the life. They can get high blood pressures even as being kids. They can have a lot of bone problems. Plus also the self-esteem goes down. So again, nutritious diet, well-balanced diet, family time while eating, no screen time or should be restricted, and a healthy lifestyle which includes exercise under supervision of a trainer at least 2 hours per day should help. Okay, so we're going to finish our live discussion here, but definitely, as I said, I'm happy to take more questions on our Facebook page, which is face-to-face@wockharthospitals.com, or you can see me personally if you happen to be in Bombay, and live a healthy lifestyle. And I hope I was able to answer some of your queries. Face-to-face. All right, thank you.